Hello everyone, Dr. Candace Creasman here with more therapy tools to help you live your best life. So today I want to talk to you about finding a therapist. So even for folks who are comfortable with the idea of seeing a therapist, you can find the process of narrowing it down to one person pretty daunting. So do I want an LPC or an LCSW, a psychologist or a psychiatrist? Then there's the whole matter of theoretical orientation. So do I want someone who does DBT or CBT or EMDR? It can almost seem like you actually need to have an advanced degree to make sense of all the ways that therapists distinguish themselves from each other. So let's take a look at some of the main factors to look for when picking a therapist. So number one, unfortunately, insurance and payment considerations. You're going to want to start here so you don't end up finding a great connection that you can't afford. I recommend using Psychology Today, which is a website, to narrow down by price range and insurance carrier first. Step two, what kind of therapy are you looking for? So what type of therapy do you actually need? There are a lot out there, so I'm just going to hit some of the highlights. So first off is cognitive behavioral therapy, or CBT. And this is probably the most widely practiced. Pretty much every discipline of counseling gets some level of training in CBT, and some practitioners go on to get extra certifications in addition. It's been found to be really useful for folks who have depression, anxiety, and related conditions, and it essentially helps you to challenge your negative thinking so that you can have a more realistic view of yourself and the world and other people. And it's been around for a really long time and is a foundation for a lot of other therapies. Next up is EMDR, which I mentioned earlier. This is a specific format for folks who have experienced trauma, and it actually helps people to reprocess their trauma memories such that they don't bring up the same intense discomfort, flashbacks, fear, and agitation when those memories are triggered. It has a really great research base and a pretty high success rate. It is very manualized though, so you're going to want to make sure that whoever is offering EMDR is specifically certified to offer it. So ask your therapist about their training and their certification if you're looking to use EMDR for trauma. Next up is one of my faves that I use with everybody, is dialectical behavior therapy, or DBT. So this is definitely one of my favorites because it's very skills-based and it works with almost any type of presenting problem. So DBT was initially developed for folks with borderline personality disorder. And these folks traditionally have a lot of difficulty managing their emotions. They have trouble maintaining relationships, and they really struggle to tolerate difficulty without engaging in problematic behaviors like self-harm or becoming suicidal. So if you like structure and homework and are really task-driven, then even if you don't have borderline personality disorder, you could potentially benefit from DBT, especially if relationships and emotion regulation are areas you'd like to improve. And I don't know anybody that doesn't struggle to one degree or another in those areas, myself included. So next up is acceptance and commitment therapy. So this is another offshoot from cognitive behavioral therapy, as is dialectical behavior therapy, and it uses principles of mindfulness and values to help you become more aware of your thoughts and to live based on the kind of person you want to be rather than getting stuck in making choices based on emotional reasoning alone. Honestly, it's kind of heady and it's kind of hard to describe, but it is way more functional in practice than it might sound on paper. So if you're interested in meditation and if you resonate with the idea of finding out how you want to be rather than who you want to be, then this style is probably for you. Okay, so now for the alphabet soup bit. What do you do with all of those acronyms for licensure types? Well, here is a Cliff Notes version. So an LPC is a licensed professional counselor. They have, at the very least, a master's degree in counseling. And it also means that they have been trained in person-centered or process-based counseling. Many LPCs go on to get more training in specific areas like cognitive behavioral therapy, EMDR, any of the other therapeutic modalities, and on and on. So check out their treatment specialties to see if they're going to be a good fit for your specific target problem. Okay, next are LCSWs, and these are licensed clinical social workers. Now, they get more training in systems, so how families and communities work. They learn about how factors like racism and sexism impact individual experience and access to resources. Just like LPCs, they often seek all kinds of additional training in specific therapeutic modalities. So ask them what their therapy style is to make sure you get what you're looking for. Next are psychologists, and they are often doctoral level practitioners. They get as much training in research as they do in clinical practice. They tend to be more intervention focused and don't necessarily emphasize just talking, as much as counselors and social workers might. They can also offer testing for a variety of diagnoses and conditions. So if you're wondering if you have ADHD or trying to find out if you have a learning disability, then a lot of times psychologists can offer the testing to confirm if those issues are showing up for you. And then lastly, psychiatrists are medical doctors. And so these are folks who have had additional training in prescribing for psychiatric and psychological conditions. They may or may not have gotten a ton of training in how to talk with you or how to actually provide therapy. So if you're looking for a psychiatrist to be kind of your one-stop shop for your mental health needs, you really want to vet them to make sure that they've actually had some training in some counseling paradigms. Otherwise, they're really only going to be prepared to prescribe meds, which is certainly important for a lot of folks, but most of the time you're going to want to have a combination of therapy and medication. So now finally for the most important factor. Pro tip here, degree, theoretical orientation, and even years of experience are all secondary to one thing, a good personality fit. So if you don't connect with your therapist as a person, one of two things is going to happen. You're either going to drop out of therapy because you don't like your therapist, or you aren't going to make as much progress as you like because the relationship will be in the way. So the number one thing to look for in a therapist is feeling comfortable. And two characteristics really help us to feel comfortable with another person. One is a non-judgmental approach, and two is warmth. As a therapist, I hear some crazy, painful, alarming, and straight up mystifying stuff, but I feel like my number one job with clients is not to respond the way many people in their lives have likely already responded, and that is with criticism and blame. So my job is not to figure out who was right or wrong, what a client did to deserve their difficulties, or even to fix anyone. My number one job is to be a safe space for you to show up with whatever baggage, struggles, and hurt you have. So how do you know if a therapist is a good personality fit? Well, you talk to them. Ask for a brief phone consultation. And I don't know a single therapist who doesn't offer a free introductory phone call, because guess what? Us therapists don't want clients who aren't a good fit either. So if you don't feel at ease talking with a therapist after 10 minutes or so, that's maybe a good sign that you should try the next person on your list. Side note here, it can be hard to share personal details with a stranger, so you're going to be uncomfortable to some level, no matter how good a fit the therapist is. The main thing to check in about is that you should notice that there's at least a slight decrease in that discomfort as you continue to talk with them. Let me hear from you on Facebook and Instagram. You can follow me at Dr. Candace Creasman. How did you know your therapist was a good fit? Or are you having trouble finding someone? I'd love to offer some guidance, so send me some questions and comments. And as always, be good to yourselves and each other.